When the Affordable Care Act, also known as Obamacare, passed in 2010, every state and U.S. territory was given the authority to expand their Medicaid program. However, because so many states chose not to do so and so many other great health care benefits and protections included in the Affordable Care Act have been and are still being attacked by this administration, we are seeing as a direct result rural hospitals closing at an alarming rate across the country.
Hospitals in states that expanded Medicaid were 84% less likely to close compared to those in states that did not expand. Of 89 closings of rural hospitals since 2010, 62 of them were in states that did not expand Medicaid. This includes 5 closings in Mississippi, 15 in Texas, 9 in Tennessee, and 7 in Georgia. From the states that did expand, Vermont, New York, and Colorado had how many closings? 0. Pennsylvania only had 2 closings.
We know that when rural hospitals close, people living and working in the rural communities affected are often faced with insurmountable barriers to the health care that they and their loved ones need. For example, there are immediate shortages in doctors and nurses because they have lost their jobs and need to find work elsewhere, and the patient's commute to see a doctor or a nurse gets longer.
You shouldn't have to drive 2 hours to get access to that doctor. And what if somebody doesn't have a car? What if they can't afford the gas money? What if their issue is actually really time sensitive, and because of the wait and because of how difficult that is, they die? I mean, that's happening in Kansas right now.
If someone in rural Kansas has to drive hours away to reach a hospital, how does that show that we care about the livelihood of our people? When a real emergency comes up, one simply may not have hours to live.
Rural hospital closings also have a devastating impact on community health centers in rural communities, and especially on those in states that did not expand Medicaid. All community health centers have helped give people medical homes by providing excellent care to anyone who enters their doors, regardless of their race, ethnicity, nationality, immigration status, sexual orientation, or ability to pay.
Just listen to Dr. Julie Griffin, who works in a community health center that is a short distance away from a rural hospital that recently closed.
At 40,000 patients strong, we're growing every day and look to top 150,000 patient visits in the next 12 months. We're doing what we can to serve Southeast Kansas and those who need a hand up, not just a handout, but some help to get them to where they need to be to move forward in their health and overall life goals. We're asking our governor and our government to partner with us and consider Medicaid expansion. We've been very shaken by the Mercy closing in Independence, which is a short 20 miles away from us, and where quite a few of our patients depend for their hospital care. We're a primary care clinic. We're able to treat primary care issues including heart disease, lung disease, kidney disease, diabetes. But at some times, those issues get out of control and they do require hospitalization. We'd kindly ask our government to consider Medicaid expansion, as that would have played a role.
So when rural hospitals close, it clearly has a terrible impact on so much more than just a person losing a place to go for their health care in their community.
When doctors, nurses, and other hospital staff loses their jobs, they not only stop spending money, which negatively impacts the small businesses in their communities, but it also negatively impacts schools, public services, and other employment opportunities. Essentially, the ripple effect is out across the entire community.
It's time to start seeing our health of Kansans as an investment.
So the big question is, what do we do? What are our solutions to stop this crisis that is devastating rural communities across the country?
Expansion of Medicaid does not matter, though, if not all individuals have the abilities to obtain health insurance. We should be striving for a healthy Kansas, and the first step to do that is to granting Medicare for all.
So anyway, I really want Medicare for all because it shouldn't matter what county you live in. You should be able to get access to a doctor.
So I think Medicare for All has a lot of potential for refinancing the more constrained rural health facilities, especially here in Kansas. I think the most glaring indicator has been most prevalent in states that have not expanded Medicare, most notably in the South. So to that end, I would say that Medicare for All is probably the best or one of the best policy proposals for strengthening rural hospitals.